Welcome to Med Madness, where we delve into the intricacies of medical knowledge to help you master the essentials for your USMLE Step 2 exam. I'm your host, and today we're discussing the fascinating changes a woman's body undergoes during pregnancy, specifically focusing on maternal cardiopulmonary adaptations. Pregnancy is an extraordinary state that induces significant changes in a woman's cardiovascular and respiratory systems. These adaptations are crucial for supporting both the mother and the developing fetus throughout the gestational period. Let's begin by exploring the cardiac changes. One of the primary adaptations is an increase in cardiac output. This increase is initially achieved by boosting the stroke volume in early pregnancy. As pregnancy progresses into the later stages, the heart rate also rises, contributing to the elevated cardiac output. Accompanying this, there's a notable increase in plasma volume. The expansion of blood volume is substantial and serves to meet the increased metabolic demands of both the mother and the fetus. Simultaneously, systemic vascular resistance decreases, which can lead to a reduction in blood pressure. These hemodynamic changes are integral in ensuring an adequate supply of blood to the placenta and other vital organs. Due to the increased volume and cardiac output, a systolic ejection murmur is commonly heard during examinations. This type of murmur is generally benign and is attributed to the augmented flow of blood through the heart. Now let's shift our focus to the respiratory adaptations. Pregnancy induces a significant increase in tidal volume, primarily driven by progesterone, which enhances minute ventilation. Despite this increase, the respiratory rate remains unchanged. The enlarging uterus exerts upward pressure on the diaphragm, leading to a decrease in functional residual capacity. This often results in the sensation of dyspnea, which many pregnant women experience, especially in the third trimester. In addition to these cardiovascular and respiratory changes, pregnant women frequently experience other clinical manifestations. Peripheral edema is common due to the significant volume expansion. The heart rate increases as a natural response to maintain the elevated cardiac output. Blood pressure, on the other hand, tends to decrease due to the reduction in systemic vascular resistance. These changes, while physiologically normal, can cause discomfort and anxiety for the expectant mother. Nocturnal leg cramps are another discomfort often reported during pregnancy. These cramps are likely due to the buildup of lactic and pyruvic acid, secondary to the increased metabolic demand, leading to involuntary muscular contractions. While these cramps can be quite painful, they are typically benign and can be managed with reassurance and proper prenatal care. It's important for healthcare providers to offer reassurance and routine prenatal care to expectant mothers experiencing these normal physiological changes. Even when the pregnancy reaches full term, induction at 37 weeks should only be considered if there's a medical indication such as preeclampsia to avoid potential risks like transient tachypnea of the newborn or hypoglycemia associated with early-term newborns. To illustrate these points, let's consider a real-life case study. Jane, a 32-year-old woman in her 36th week of pregnancy, came to the clinic concerned about swelling in her legs and a persistent feeling of breathlessness. During her examination, a systolic ejection murmur was detected. After a thorough evaluation, it was determined that Jane's symptoms were due to the normal hemodynamic and respiratory adaptations of pregnancy. She was reassured and provided with guidance on managing her symptoms. Her blood pressure was slightly lower than her baseline and her heart rate was elevated, all consistent with the expected changes. Jane was advised to elevate her legs to manage the edema and to practice breathing exercises to alleviate the dyspnea. Her nocturnal leg cramps, though uncomfortable, were explained to be a result of increased metabolic demands and were managed with proper hydration and stretching exercises. Jane's case is a testament to the incredible adaptability of the human body during pregnancy. Understanding these changes allows us to provide better care and support to expectant mothers, ensuring both their well-being and that of their babies. Thank you for joining us on Med Madness. We hope this episode has provided you with a clear understanding of maternal cardiopulmonary adaptations during pregnancy. Stay tuned for more insights and in-depth discussions on essential medical topics. Until next time, keep learning and stay curious.